Hello, I'm Courtney Miller. I'm one of the ears, nose, and throat specialists at Cape Cod Ears, Nose, and Throat in Hyannis. And this talk is going to focus on Inspire therapy for obstructive sleep apnea. To start, I have no disclosures. The objectives of this talk are to first discuss what Inspire is, how it works, its mechanism of action. We would discuss indications and requirements for Inspire, discuss who's a good candidate for it, and then look at therapy overview and outcomes. And so just a brief history of Inspire. It was FDA approved in 2014. By spring of 2022, 25,000 patients had been treated, and they're continually expanding their inclusion criteria. For example, in spring of 2023, they've now included pediatric Down syndrome patients as good candidates for this therapy. So Inspire is an implantable device. It helps provide gentle pulses to the hypoglossal nerve, which moves the tongue forward at night to relieve obstruction. Patients turn the device on at night with a remote control. It kicks in about 30 minutes later, and it senses when patients breathe in at night. And when they breathe in, it sends a gentle pulse stimulation to the hypoglossal nerve, which then allows the tongue to protrude forward, which is how it relieves airway obstruction. The surgery itself takes about an hour and a half to 2 hours. We perform it through 2 small incisions, so one on the right chest and one in the right upper neck. It's a fairly easy recovery. Pain is minimal. We don't require any narcotics. We ask that patients avoid strenuous activity for up to 4 weeks, but within a few days they can return to non-strenuous activity. The battery life is about 11 years. If we need to do a battery change, we can just access it through the right chest incision. So it's not a very long procedure in terms of replacing the battery when that's needed. And the good thing about it is MRI safe and compatible, and also compatible with other imaging technologies. Just to look at a schematic of the implant from a different view, you can see that the implant and the breathing sensor sit in the right chest, just over the pectoralis muscle. And then it's connected to the hypoglossal nerve via a wire that runs up the right neck, and we attach it to the right hypoglossal nerve. And so again, when the device is turned on at night and it starts working, it senses when the patients breathe in and then provides a gentle stimulation to the nerve, which then makes the tongue protrude forward, again, relieving that airway obstruction. The good thing about Inspire is that it doesn't just relieve obstruction at the base of tongue, but also at the palate, so it's kind of a multi-level mechanism of action, which makes it quite effective. And so this is a slide that you might want to screenshot or take a picture of. Many of our patients here on the Cape have Medicare, and so these are the requirements needed in order to get it approved for our Medicare patients. And so the first one is the AHI requirement. Patients who are good candidates have moderate to severe obstructive sleep apnea, and so for Medicare, that's a AHI of 15 to 65. We use the AHI 4% criteria and not the AHI 3% criteria for this. We also need to see on their sleep study that they have less than 25% central or mixed apneas, so predominantly obstructive apneas and hypopneas. The sleep study should be done within 2 years of the initial consultation with me, and home sleep studies are just fine for this workup. We don't need an in-lab sleep study for Medicare. And so if their numbers check out in terms of the AHI, the next thing we look at is their BMI. Medicare requires a BMI of 35 or less. So some patients do need to lose weight before they can get approved by Medicare. And we have to document that they've tried CPAP and have not tolerated it or failed it. CPAP failure is defined as a persistent AHI over 15 despite CPAP usage, and then intolerance can be for any reason, whether it be for discomfort or claustrophobia, but we just have to be able to document that they've used CPAP less than 4 hours per night for less than 5 nights per week, or have returned the machine. And so once we meet those requirements, the next thing we have to do is something called a DISE, or a drug-induced sleep endoscopy. And so this is a brief airway evaluation in the operating room. Patients will come into the hospital, they'll undergo some sedation with propofol, and while they're sleeping, breathing spontaneously, and snoring, I evaluate their airway with a small camera. And basically, it's just to look at the level of collapse when they snore in their airway. There's only one finding that would make them not a good candidate, and that would be complete concentric collapse at the palate. We don't see that often, probably less than 5% of cases. So most patients after the drug-induced sleep endoscopy are still good candidates for Inspire. And other just indications, requirements in general, patients need to be 18 years and older. Depending on the insurance, there are different BMI requirements. So Blue Cross Blue Shield of Massachusetts, Blue Cross Blue Shield Anthem, MGB, all require BMI of 32 or less. Medicare and the Blue Cross Blue Shield Federal Employee Program require BMI of 35 or less, and then you can see the remainder listed there allow for BMI up to 40, which is wonderful. And most, like I said, most patients should have a sleep study done within 2 years of initial consultation. Most insurances are fine with the home sleep study, but United does require an in-lab sleep study, so that is the one difference there. When we look at the data from their initial trial, their 5-year data, you can see the baseline AHI for patients was 29.3. At 1, 3, and 5 years, patients' AHI were brought down into the mild range, ranging from 6 to 9, and that effect was sustained. And so one of the main goals for Inspire is to either bring the AHI to less than 15, again, into that mild range, or to decrease it by 50%, depending on their baseline severity. And you can also see from this data here that the Epworth sleepiness scale, or Epworth scores, decreased significantly. And again, that effect was sustained after 5 years. And this just reiterates some of that data. Again, shows the reduction of AHI in the Epworth scores. 67% of patients from the ADHERE registry had a final AHI of less than or equal to 15, and 69% met that threshold of 50% reduction and an AHI of less than or equal to 20. It's a very safe procedure. Over 99% of patients are successfully implanted without any major complication. It has fairly good patient satisfaction. So patient satisfaction ranges from anywhere 90 to 94%. And partners, significant others, reduce a significant reduction in snoring. And looking at overall satisfaction, again, there's 90% for the Inspire, and when you compare it to CPAP, patients rated Inspire as better than CPAP. 91% of patients rated Inspire as better than CPAP. And when we look at patient adherence or overall use, the average therapy use for Inspire was 5.7 hours versus just 4.5 with CPAP. And so when we look at order of events, patients would have their initial consultation with me. Sometimes I'll have to order an updated sleep study if we don't have data within 2 years, or if we have that requirement of an in-lab sleep study for United. We can talk about weight loss if needed, if their BMI is slightly elevated. But once they meet the criteria based on the sleep study results and the BMI, then we can schedule them for that brief airway exam in the operating room, the drug-induced sleep endoscopy. And if that all checks out, then we can finally schedule them for the implant. So it's not a very quick process. There are many steps. But once they get the implant, I'll see them 1 week after surgery for a wound check. And then we actually activate the device 1 month later to allow things to heal. There's some fine tuning in the months after it's activated. And the goal is to be able to do a sleep study about 3 months after activation or 4 months after surgery. The Inspire rep will be present during that sleep study to allow for some fine tuning if needed. I think just some important points that I'm realizing, out in practice is that I try to set, clear goals and expectations for patients. One is that Inspire is only treating sleep apnea and not other sleep disorders or issues. Patients with insomnia or other sleep disturbance, frequent awakenings at night related to other things. Well, unfortunately, the Inspire won't fix that, but I do try to stress the importance of not having untreated sleep apnea. The other thing I try to stress to them is that it is a real surgery that requires some recovery and downtime, and it's not going to be perfect at first. It does require some practice and patience. We will not perform the surgery unless we absolutely know it's covered by insurance, and most insurances will cover it as long as they meet the criteria that we talked about. And as a provider, you can also download the app just to get a bit more information, see real patient feedback, watch other videos for common, that would answer common questions and teach you a bit more about how Inspire works. But any questions, everyone should have my information either before or by the end of this. Feel free to email me or reach out. And thank you for taking the time to listen.